First at 6, preventing an outbreak. Good evening, I'm Marcia Baumhart, Mark Allen, Katie Houston, the night off. Tonight, we're digging into the procedures local hospitals have in place. This is to limit the spread of a deadly disease like Ebola to those who are treating patients. Natalie Tyndall got a look inside a local hazmat room.
Well, federal health authorities are telling the nation's hospitals to think Ebola. This after the CDC confirmed a nurse from Dallas is now the first person to catch Ebola in America. She was treating the patient who brought over the disease from Liberia before he died. Now the question is, do hospitals have enough procedures in place to keep their staff from getting sick? Now that a nurse has contracted Ebola from her patient, all eyes are on the healthcare industry and how prepared they are to deal with this deadly virus.
We have to rethink the way we address Ebola infection control because even a single infection is unacceptable.
More than 75% of nurses surveyed by a national nurses union said their hospitals have not issued an official protocol for Ebola. Those surveyed also said their protective gear is not enough. So we asked a local hospital how prepared they are to deal with infectious diseases.
We're prepared for this.
Kettering Emergency Department has an infectious disease protocol in place that starts evaluating the patient from the minute they walk into the emergency department. Once they determine a patient may have an infectious disease, they isolate them. Rooms like this are used, and nurses and doctors have to follow the CDC's rules before they can have any contact with the patient.
We need to limit the exposure to any body fluids, and that is with this very elaborate gown, mask, goggles and gloves, shoe covers, leg covers if need be.
Health officials still don't know exactly how the nurse in Dallas contracted Ebola to begin with, but they say it was a breach in protocol in treating the patient. The CDC says they'll be looking at new ways of removing protective gear. Staff at Kettering say that process is very important.
So if you break away from the gown, then you can keep all the contaminated material that's on the outside inside this and not have it touch your skin. So it's very critical to remove it just right so it doesn't splash back up on you.
Kettering health providers say they'll continue to follow the CDC's recommendations to ensure they're not only protecting their staff, but also the community.
If we get sick, we've just exposed that many more people to getting sick as well.
Now, a national nurses union is calling for higher protective standards for hospitals, including hazmat suits, after learning the nurse infected was not wearing one. Now, doctors at Kettering tell me that solution is not as simple as it sounds. They would have to find new ways to decontaminate the suit, and there may not be enough of them. Natalie Tyndall, 2 News, working for you.